We run a program in our agency where we work with a local farmer that delivers produce every week to our agency. And so we get seniors to come here and utilize their farmers market coupons. And so last year we did it, but the ordering process was incredibly cumbersome. You would have to do it over the phone, and each order could take a half hour to get an order from a senior. If anybody sat down with a senior and tried to get them to make decisions about something, sometimes it can be very cumbersome. But now this year it went so much more streamlined, where we just sent a text, and these are the offerings for the week. This is how much each offering is. They send a text back, and literally our RD last year spent almost every hour of the day for the week of the produce doing the orders. It was incredibly time consuming. Whereas this year it was almost no time. The only time that was spent was the day of picking up the order. They would come in and the order was all set. And another benefit that we're finding, and I think we're going to find much more benefits moving forward, are surveys. When we send out a survey, we get anywhere from 10, 15, maybe 20% on a really good survey response. I don't know about other AAAs. That's what we typically get, which I don't think is terrible. But again, you want to get as high a percentage as you can. But when we do it through Blooming Health, I mean, we've gotten over 50% on a lot of the surveys that we've done. Because if they get a text or they get a voicemail, they tend to react to that. Reminders about, you're going to have your annual evaluation coming up, and things like that are just, I don't know how many people have done that before, where you end up trying to call them to, confirm an appointment. You don't get the call, and then do you go out and do that? And then you go out and they're not there, or they forgot about it. A lot of these things are just, it's so automated and so just not time consuming, I guess is the best way. It saves staff time more than I could have imagined. It's been very, very beneficial for our agency. Because it was a cost for us on the front end, but we've saved so much more staff time because of it. And I was pleasantly surprised with that. And we also have a large Hispanic population in our largest city in Amsterdam. It's about a third Spanish speaking. And that's one area that we're going to expand even more because we can do a lot of things in Spanish. We haven't really tapped into that yet, but we were excited about that as well, because we do have a bilingual staff member here, but we expect to utilize that much more moving forward. So we were excited when she said that you could do it in multiple languages, because it's about 12% of our county as a whole. But in a nutshell, that's what we're doing, and we're excited about moving forward and using it even more than what we're using it now. We've really just scratched the surface on what we can do with it, and they've been a pleasure to work with as well. Anything we've needed, they've reacted to it and been right there to help us as we go. And I think it can be tailored to whatever you need as far as your program, and it can target that exact audience that you're trying to target. And that was the selling point for us, that we're not going to be pestering seniors with messages that they don't need or they don't want, and they can opt out anytime. Yes, I can count on probably one hand the amount of seniors that have opted out. I don't think it's been a handful maybe, and they probably would have opted out anything.
With our home delivered meal program, the other day I was sitting, my office is next to one of the home delivered meal workers, and she was calling a whole route to tell them the meal was late. And I don't know how many hours she, it was at least an hour and a half of our time. And we are all very short staffed in my office, 5 people down right now. And I thought to myself, we've got to get that going. So we are putting the proper list together by route now. We put lists by program. So what we've had gone out, we had one go out the beginning of this week about our public hearing. And all of you know that's not necessarily a popular thing, the public hearing with people. And we do couple it with another presentation on Medicare, but we must have gotten over 40 people that day, or between that day and the next day, to call and sign up. So we doubled the participation so far on that. So I think, like Dave, we've only scratched the surface on what we can use this for. We're working with Ed on their team, who's very, very helpful and helps us craft messages. We're next going to be crafting some surveys, particularly for our Medicare 101 program and for some of our other programs. So, again, I think it's been a very positive experience.